Welcome to Value-Based Voices, a podcast from the Association for Value-Based Cancer Care. Each episode dives into the shifting terrain of cancer care in the United States, exploring what value means in today's clinical, policy, and patient-centered environments. Our mission is to spark informed dialogue, promote transparency, and equip every stakeholder, from providers to payers to patients, with the insight they need to navigate cancer care with clarity, confidence, and purpose. So let's get to it. My name is Dr. Ira Klein, and I'll be your host for today's episode. With me is Harry Travis, pharmacist, entrepreneur, general innovator in the world of AI and other, and we'll be talking about AI and its relationship to the practice of pharmacy and pharmacy benefit. So welcome, Harry. Thank you for joining us.
Hello, Ira. It is great to be here.
Well, we've got a big topic to cover, and it's a topic that has both frustration, hope, and uncertainty. Because when we talk about the cost of healthcare today, much of that dialogue has been about the cost of drugs, the ability to have access to drugs. And then when we talk about things that are happening as macro trends, we think about the AI revolution, but it seems like a silent revolution in healthcare because we haven't seen real tangible progress other than a few inklings. So when we think about the relationship of artificial intelligence to the pharmacy benefit and the practice of pharmacy, I almost don't know where to begin. But tell me what you think is a good place to begin if we take this from the perspective of the system is broken and we want to make the system better. Where would we start?
You're right. There are a lot of both positives and negatives. I think we all agree we're at the kind of the precipice, turning point, whatever, of a lot of things happening, and we hope a lot of them are going to be good. Let's start from the perspective of a patient getting a prescription filled.
Great.
Okay.
I've been in that shoe.
Right. There are 7 billion prescriptions dispensed in the United States, according to IQVIA.
Mm-hmm.
Okay. If you normalize all the prescriptions, 30-day supply, not everyone is, but and just count them that way, it's 7 billion prescriptions. All of them, no matter how simple they are or how complex they are, all go through an 8 or 10 step process of intake and benefit verification and prior authorization and DUR and patient follow-up and financial exploration around copay assistance and all of that.
And that includes even if I want a generic statin.
That's right. And if you want a generic statin, it may go through that process in a nanosecond. Mm-hmm. If you want Keytruda, on the other hand, it could take a long time, as we know. Okay?
Yes.
But every step in that process is, if you just boil it down to kind of in engineering terms, every step in that process is there is a set of questions at that step that need to be answered and to be moved to the next step. Do I have all of the patient's demographic information? Do I have their health insurance information? Boom. Now I can move to the next step. Now I can, right?
Yeah, well, to our listeners who may not have seen the imposing 15-page prior auth form for some of these cancer drugs,
Right.
That's a big task.
Right. And my point is, with respect to AI, every one of those questions has an answer somewhere. The practice of pharmacy, not minimizing it, and I am a pharmacist. I love all my pharmacist friends. It's very deterministic. It's very data-driven. Okay, when you see a pharmacist in a drugstore standing at a screen in front of a computer, they are not composing anything. Okay, they are looking for data somewhere else, and AI is going to help us do that. There are literally dozens of entrepreneurial companies now focusing on every step in that prescription filling process to automate it or enhance it or optimize it.
So you're saying from a process engineering perspective, it's a series of tasks that are data driven. So how do you train them?
Yeah, you have to work. We're very much in a kind of point solution validation mode right now. There are lots of vendors out there that are coming to the pharmacies and the PBMs with, I have a solution for you for this step. And we have to take the time as a profession to validate that these agents, algorithms, solutions can work at incredibly high degrees of effectiveness and efficiency and reliability.
Now, if they do that and we prove them out, can I make the assumption that they're going to do it in almost real time?
You can.
Oh,
You can on some of the tasks. On the concept of a queue, okay, of work, okay, is really one where you have a human sitting in front of a terminal working through a list of tasks, okay? I've got 15 cases I've got to review, and it may be a very small amount of checking data. Well, you can have an infinite number of AI agents run that. You don't have to have one AI agent looking at that queue. You got 15 tasks, you just infinitely explode the number of AI agents, and boom, it's done. We really have to almost rethink workflow as a result of this.
So who does this? So when you say rethink the workflow, I think reshuffle the workforce. Now, you and I have known each other for many, many years, several decades from Aetna days. And I was a pharmacist before I was a physician.
That's right.
And I sat in the back of or stood in the back counting the pills and answering the phone calls. So when we think about the workforce with AI, what's going to happen?
Well, before we even think about that, just go back to put ourselves in the shoes of all of the operators that are out there now, the leaders in pharmacy and PBMs. It's not like everybody's got a lot of time available to run all of these projects.
Free time and healthcare are not two terms that go together.
Right. So we have this dilemma of, we're seeing these tools that look great, but we've got to validate them. That takes time. But by the way, I've got an operation to run. So there is a real constraint here that we're just going to have to work through. Okay. So yes, at some point we're going to slowly make progress. We're going to get these tools validated, and we're going to start to see productivity improvements.
So some entity or entities, because the healthcare ecosystem is complicated, and we all in this I don't want to say it's not a virtuous or non-virtuous chain, but in some ways we're all obligatorily chained to each other. Some of these other entities in the chain are going to have to take a little bit of risk and join in and do it.
Oh, absolutely. AI is such a ubiquitous technology. So it's not like, well, this is a pharmacy thing.
Right. You can't just simply nest it in one place.
Right. Which adds complexity to it, because our colleagues in medicine, or our colleagues in the revenue cycle management department, or our qualities over in legal are all getting faced with AI projects and vendors and tools as well. Okay. So it's, anytime you run a project, it's usually a multidisciplinary project. And okay, I need somebody from legal over here to review this. I need somebody from quality to review this. Sorry, I'm over here on 5 other. Okay. So we've got a time management issue. Like all things, we will work through it.
Right. So businesses will figure it out.
Right.
Okay.
And I think where you were headed is, okay, when we reach the point where we're seeing real benefit.
Who are the bodies who do this? Where do they go?
Yeah.
And if they can't fit into the new system, what do we do with them?
Yeah.
Where can they be reallocated?
Yeah. And I think pharmacy is a really interesting case study. Let's remember that the practice of pharmacy is regulated at the state level. What a pharmacist can do is defined by their individual board of pharmacy. Okay? So the thought of, okay, we're going to allow now pharmacists, you hear the phrase all the time, we're going to allow pharmacists to work at the top of their license. Okay? Well, it depends on what the state defines as the top of your license, right?
Some tops are higher than others.
Exactly. Some ceilings are much higher than others. Some ceilings are much lower than others.
Yeah.
So AI presents, one of the first real positive opportunities for pharmacy teams. Let's just not say pharmacists.
Right, because one thing I learned, which I think held me in good standing as I went through medical school, and then after my clinical career led business operations, pharmacy is a profession that teaches you that healthcare is a team sport.
Absolutely.
Yeah.
Absolutely. And, look at any drugstore. Just walk into any drugstore, stand back and observe the pharmacy quietly for 5 minutes. And you see this beehive of activity of a pharmacist, maybe 2, 3 or 4 technicians, a clerk. It's just a cool little quartet working their tails off in there. So that team, that pharmacy team, it could be in a community drugstore, could be in a specialty pharmacy, could be in a big mail order pharmacy, could be in a hospital pharmacy. That team is going to get significantly more productive. You are going to have to spend far less screen time. Stand in that drugstore and watch how much time the pharmacist is standing in front of the screen.
A lot.
It's a high percentage. We are going to free them up from that. Okay.
Well, that's a good thing, because I have to say the COVID era taught me some things about how we jigger and rejigger our workforce. And with pharmacists giving a whole slew of vaccines,
right.
When I first had that happen, I was talking to my local pharmacist, and he said, I think this is great. I feel like this is one of the things I went to school to do, to be a part of the healthcare of my community. Now we fast forward 4 or 5 years later, that same pharmacist will say, it's the right thing to do, but I have 1,000 other things to do.
Exactly. We added vaccinations.
But we didn't add more bodies.
Exactly. And hopefully AI will allow some kind of capacity relief there. But going back to the state board rules, as I was saying, different states regulate pharmacy very different. So for the audience listening here, the way you can practice pharmacy in a state like Idaho is very different than the way you can practice pharmacy in a state like Florida.
Right.
Okay? Idaho has adopted what is called full practice authority, where pharmacists can actually prescribe medications up to where they feel they are capable of prescribing. So basic things like hypertension, diabetes, smoking cessation, things like that, birth control, those prescriptions can be written by pharmacists. And you're seeing, and again, or not, in addition, we have a primary care access problem in this country.
For sure.
Statistics, estimates are 30% Americans don't have access to good primary care, just basic care.
Right.
I think I might have high blood pressure, or my parents had high cholesterol and I don't know. You can now do that in a pharmacy.
And instead of waiting 9 months to find someone.
Exactly. But there's only about 5 states in the country that have adopted and rewritten their board of pharmacy regulations to full practice authority.
So if I superimpose on that a new mandate that says, okay, AI will now improve the efficiency of the pharmacy team, expand duties where safe and effective, who's doing the oversight of this if AI is in the mix? Because if now every state is determining their pharmacy capabilities, I'm not sure I want 50 states having 50 levels of determinations of AI capabilities.
And that question is being addressed right now by the National Association of Boards of Pharmacy.
Yeah.
It's also every medical profession. The National Association of Medical Boards, National Association of Nursing Boards, because all of the medical professions are,
need this.
Are regulated at the state level.
Yes.
The feds don't regulate medicine.
I know that every 2 years when I write my check to the state of New Jersey to keep my medical license.
So the New Jersey Board of Medicine is trying to collaborate with California and every other state, because it's like, we don't want to have this quilt, this patchwork
Yeah.
of AI regulations. So the national associations of the boards have all of a sudden become even more important
Right.
and are at the NABP level, National Association of Boards of Pharmacy. They've impaneled now a whole technology resource center.
So this is good to hear, because I always become afraid when I feel that there's a patchwork of regulations that sometimes are more self-serving to the guild-like
Exactly.
influences of certain states. But let's just put that aside. If we assume this will be solved, what improvements do you see, and what will they look like?
Well, it's going to take a village because
What does that mean for me, average Joe American?
Right.
I might have a high cholesterol, and because I did crazy things growing up, a series of orthopedic issues.
Yeah.
How's my life gonna be better
Yeah.
with AI and pharmacy?
One, it would be nice if we could have some kind of public service campaign that patients would think to ask their pharmacist that, hey, could you help me here, right?
Oh, so because they don't know.
Exactly. I mean, we've got the profession's got to educate the public on this. And of course, just because the regulations would be rewritten to allow pharmacists to do this doesn't mean that they're going to get paid.
Well, getting paid is one of those things in life that kind of has to happen.
Right. So in those states where full practice authority has been implemented, generally the first payer to fall in line, because it's state, is the Medicaid. So Medicaid gets in line with it because they say, okay, if we can get better primary care for Medicaid.
Right, because access is key.
That's a good thing.
Right.
And then you'll see commercial follow, and then finally you'll see CMS follow, kind of the laggard of everything.
Got it.
But there will be a long kind of transition here to a state a state not in the 50 states, but a professional state that has pharmacists across the country expanding their practice and getting paid for it and being free to the tyranny of the computer.
Well, let's change the channel for a minute and then go and talk about the corporate level. PBMs, SPPs, insurance companies. How will AI positively impact the practice of pharmacy for those entities who are obligatory parts of the supply chain?
Yeah. Hopefully it's something as simple as speed to an answer. Okay. Because with AI, just in really basic terms, what AI and large language models allow us to do is read unstructured data. And we know that the whole healthcare system is just this Tower of Babel of unstructured data.
You're talking about my career here.
We have built it on, and we've always been driving to get everything standardized. Well, now we have, it's almost like we have a magic wand that's a universal translator. So that the prior auth rules, think very simply on a prior auth for a particular medication. I got 12 questions I have to answer, and I have a 50-page EMR that the answers are in. Okay. Now I can have an agent find those for me.
Great. I don't have to have a panic attack when I click on some insurance company's EasyPA link, web link.
Right.
And then the 50-page form comes up.
Exactly.
And I still have to manually enter the information.
Right. And on the reverse of that, the insurance company, PBM or otherwise, doesn't need to panic when some small practice faxes them 50 pages of patient notes and says, here's the answer.
They'll scan it and AI will read it.
Exactly.
Got it.
Exactly. And which is an amazing thing, because I was on the receiving end of that. One of my prior jobs of, practices would almost in frustration say, all right, here you go.
Now, I know that you were running specialty pharmacy in South Florida.
Right.
I was spending a lot of time at headquarters in Hartford, Connecticut.
Right.
And we both know that you had a lot of butts and chairs in Florida.
Right.
And in the basement of that 8-story brick building in Hartford, we had a lot of butts and chairs with their faces on computer screens.
Right. Right.
Yeah.
Which brings back to a question I think you were alluding to early on. As a society, across all industries, we really need to get ahead of kind of the workforce impact here.
Yeah.
There could be a lot of hardworking folks kind of in the lower ranks of any organization, hardworking, intelligent folks who
Well, these are tough jobs.
Right. Who all of a sudden have their jobs, at risk.
Right.
Okay? And every organization needs to kind of up their game in terms of upskilling, how we train people, how we prepare them for it. Change management, is just going to become an even bigger challenge for everybody. But just because, oh, wow, 50% more productive. Okay, that sounds great. And the guys in finance and gals in finance are salivating over this. But we really need to think through the human impact of this.
Well, we have to close it up soon. But in terms of the workforce and the impact, do you have any prognostication about where these people would go and what they would do?
We look to the past, and I'm following all of the arguments and the philosophers, and they say, look, we transitioned from an agrarian economy to an industrial economy, and we transitioned from an industrial economy to an information-based economy, and the world didn't end in all of those, okay? And it's not going to end this time either. We're smart, we're intelligent, but it's probably going to be harder than in the past. And so the more people kind of realize that, say, okay, buck up. This is going to take some work, but I'm confident we're going to be able to figure it out. And to think about a world where we have more time in healthcare to spend with patients at every profession, be it medicine, pathology, pharmacy, you name it.
Yeah, nursing, therapy, anything.
Where you have less paperwork is really a goal we all should be working toward.
Well, that sounds like a better future. And, speaking of smart and intelligent, you've always been that since I've known you.
You're so kind.
But,
thank you. Likewise.
But unlike AI, you're easy to talk to. So I just want to say that this wraps up this episode of Value-Based Voices, brought to you by the Association for Value-Based Cancer Care. A heartfelt thank you to Harry Travis for sharing his insights, and to you, our listeners, for joining the conversation. If you found today's discussion thought-provoking, be sure to subscribe to Value-Based Voices wherever you get your podcasts. Stay tuned for more episodes that spotlight the voices shaping the future oncology, and thank you again.